about getting a health app reviewed and accredited. And it sounds really simple, but it's actually extremely complicated and complex. And this isn't just about working in the NHS, because as we know, digital health is a global opportunity. And so what I'm going to do is I'm going to talk to you today about why getting your digital health solution is reviewed is important, what it involves, getting you ready to do that, along with sources of support, and then we'll have some time for questions and answers. I think I've been given about 20-25 minutes to talk to you today. So if I don't get to everybody's questions, very happy to take them offline if that's helpful. So the first thing I just wanted to do really is just set the scene for digital health and health apps. And this really sings to the first learning objective, which is, why is this important? Why is it important to get your health app reviewed and accredited? So basically, we have a huge amount of health apps and digital health solutions. When I use the word health app, I do mean apps that are on the Apple App Store and Google Play, but I also mean web-based solutions. And you know, I'm not sure whether apps will be the word that we'll use moving forward, but at the moment it's the word that people like. People tend to respond most positively to, because they understand what app means. So that's just really to put that in context. I mean, obviously, really my preference would be to call these digital health solutions rather than health apps. So basically, we have loads and loads of health apps. You know, around about 375,000 solutions on the app stores, but also that this is relating to websites and web-based solutions as well. And what's really interesting is every day 5 million people will download a health app. And that's increased by 25% since the start of COVID. So we used to see about 4 million downloads every day. And we're now seeing 5 million, and it's increasing all the time. And I think what COVID's given us is this platform for digital health and health apps to be used more and more. So there's a huge array of products, lots of people are using them. And then when we speak to healthcare professionals, what's really interesting is there is a rising popularity of digital health solutions and health apps amongst our clinical communities. So 80% of professionals are already using smartphones and medical apps. 40% believe that these products could help to reduce visits to the doctor's office. And over 90% believe that these apps could improve patients' health. The problem isn't, the problem then is, well, which products should we be using? And if we look at the landscape of digital health apps by category, it's really interesting just to see how things have started to shift. So a couple of years ago, the majority of products sat in wellness, and this is still really important and is really critical actually at the moment. More and more people now want to stay as healthy as they possibly can, because they want to make sure that they're as well as they can be for in case they contract the current virus, COVID. But what we've seen is a significant increase in health condition management tools. And this is really where the healthcare sector at large is really thinking that they can start to leverage some of the opportunities. And obviously we all know about the mental health crisis, and we know that there are thousands of solutions available within that health condition management, but there are also other long-term conditions that we really want to support people to manage, so diabetes, COPD, asthma, and we're seeing a significant increase in health condition management tools. So there's a huge opportunity. And so because we've got this huge opportunity, you know, you'll see that healthcare sectors across the world are really starting to look to digital health and think, well, how can we leverage this opportunity? And that then begs the question, well, why haven't we done that already? You know, why have we as a system not picked up what the opportunity is within the world of digital health apps? And these are the 4 big barriers. There are lots of other barriers, but these are the 4 big barriers. So the first barrier is awareness. It sounds really simple, but most people aren't aware that there are digital health solutions available for them or their loved ones. And this awareness is really low. So if you go out into the street and ask people, did you know that there's a health app that could help you with COPD, diabetes, mental health, they wouldn't have known that these products were even available. And this awareness isn't just low amongst our populations, it's also low amongst our healthcare professionals. So that's my background. I was an NHS clinician, and my awareness was pretty low, obviously before I got really interested in this area, but my colleagues' awareness is also low, so they just didn't know that there were solutions available. We're not trained in this. The second problem is, once you become aware that there are all these solutions, the second challenge is, how do you access them? And I mean this at the most basic level. So if I now know that there are 6,000 digital health apps for dementia, where do I go to find them? Even finding a long list is really, really hard. If you go to the Apple App Store or Google Play, excuse me, you'll find that you might get one or two solutions presented if you type in a word like dementia. So just accessing a long list is a real problem, and that puts in another barrier. The third challenge is trust. So once you find a product, how do you know which products you can trust? And our research has shown that only 20% of digital health solutions actually meet the quality criteria that you'd expect if you were going to use a product or recommend a product to your patient. And so this lack of trust is not unfounded. And the problem is, if you're a leader working within a healthcare system, or you're a clinician wanting to recommend a solution, how do you know which products you can trust and therefore recommend to your patients? It's really worrying. And as healthcare professionals, we are trained to be skeptical. We're trained to look for the risks. But because we're not trained in digital health apps, actually, we don't know what we don't know. And so that breeds a mistrust. So it's a real challenge, that trust. And then the fourth challenge for healthcare systems using digital health apps is governance. And what I mean by that is, excuse me, ongoing management of risk. So what's brilliant about digital health solutions and digital health apps is that they respond to user feedback. And many of you will have products that you will iterate over time, gathering feedback from patients and people and clinicians, and you'll improve your product over time. And that's brilliant. But for some products, what they do is they'll introduce a new function or feature, which then could create a clinical safety issue or a data breach. And so if I recommend you a product as your clinician and then it changes in an unsafe way, how do I know and how do I monitor and manage any future risk? And that just puts another huge barrier into incorporating digital health apps into the world of healthcare. So these are all the reasons why you need to really get your product accredited, because getting it accredited means that you're going to first of all deal with the trust issue. And I'm going to talk you through the work that we've been doing at ORCHA, and also share with you some of the accreditation processes that are happening not just in this country but also internationally, and also share with you how we've been dealing with the awareness, access, trust and governance issues to really get and distribute high quality products to people, patients and healthcare professionals. And hopefully that will be useful to you today. I can see some questions are coming through, which is brilliant. Keep putting them in and I'll pick them up at the end. So the first thing to say is you may have heard of certain digital health assessment frameworks, both in this country and internationally. So just last week, NHSX announced their DTAC assessment framework, but there are other assessment frameworks internationally. And really what these assessment frameworks are trying to do is really trying to eke out, well, how do we deal with the regulations and the standards and the best practice guides that are available to us, it's a confusing landscape. So there's around about 2,500 standards, regulations and best practice for digital health apps. And they tend to fall into these 4 chunks. So data privacy, data security, clinical assurance and user experience. And what's really interesting is this isn't a static landscape. This landscape keeps changing. New regulations are emerging, new standards are emerging. And so it's not a static regulatory landscape. And equally, not all of these regulations apply to every single product that is on the marketplace. So, for example, I'm just going to give you an example of what I mean by that. So, for example, there are digital health apps which are basically a recipe book, or is a digital version of something that is on paper, and that doesn't pull any data. It doesn't need to be compliant with data security. The clinical assurance would need to be quite lightweight, but obviously the user experience would be really important. That's a very, very lightweight regulatory requirement for a product. However, at the opposite end of the spectrum, you've got a product like Neomate or the Mersey Burns app, and these are products which are used by doctors to help them work out, well, how much drug do I give a patient, or how much hydration do I give a patient? And the impact of that product going wrong could mean death. And so the clinical assurance has to be critical. Plus, if those products are pushing data into and out of clinical environments, then data security and data privacy is equally critical. So this regulatory puzzle is a challenging one. Just to give you an idea of things within each of these buckets, and you're very welcome to have these slides. Under data privacy, we've all heard of GDPR, but there are other standards, particularly around models of consent, authentication, etc., and system interoperability, which is a big focus for a lot of systems at the moment. Data security, so this is very much focused on compliance with OWASP, and then there are other accreditation regimes such as Cyber Essentials and ISO 27001, for example, which are really important if you meet the criteria for that. Clinical assurance is the one that's absolutely rammed with regulations. So you may have heard of the medical device regulations, medical device directives, soon to be regulations, and there's some major changes happening next year, which the UK will not fall under. So there's going to be a UK certification assessment process, which will be separate to the medical device regulations. And that will, the details of that will emerge over the next month or so. But in the UK, you will also have heard of the CQC registration. So if your product provides a service, you need to have CQC registration. You might have heard of clinical safety standards, which is also something which is very specific within the NHS, but other parts of the world are also picking up that now. And then you will have, I'm sure, heard of the NICE evidence standard framework, which is again about measuring impact of the impact of a product and looking at the evidence for that impact. So there's quite a lot within the clinical assurance, but not all of these regulations would necessarily apply to your product. And within each one of those regulations, excuse me, there is a tier. So in the NICE evidence standard framework, for example, there are different tiers depending on the complexity and the risks associated with the app. So it's complicated. Now, user experience, this is the lightest of all areas from a regulatory perspective. Obviously, there are some standards around usability and accessibility. What we're trying to do is work with the regulators to build a relevant user experience standard so that we can then apply that standard to help people know which product would have the best impact for them at what point in the pathway. So this is quite lightweight at the moment, but this will be an area of growth from a regulatory perspective. So it's confusing, absolutely. So what we've seen is digital health frameworks starting to emerge, both in this country and internationally. And these digital health frameworks are trying to make sense of the challenging landscape that I've just tried to describe. So you'll see that there are digital health frameworks in Belgium, in Germany, in the NHS, all over Europe and internationally as well, in America. And I'm going to talk you through how we've been working with a number of these organisations to try and leverage the benefit of the work that the innovators gone through rather than duplicating, which is what's been happening so far. So it's very, very confusing, and it's challenging if you want to market your product internationally, because it feels that you have to restart the process of accreditation review every time you start to want to work in a different country. So what we've been doing is we obviously do work with the NHS, and we've been working with the NHS for over 5 years, but we also work in 11 other countries. And so this, I'm just going to share with you now how we've been making sense of this, and how we've been really trying to support innovators to only have to go through the bulk of the assessment once and only once, so that you can start to gather badges of accreditation. So what we do is we layer the review, and I'm just going to talk you through what I mean by this. So we have the ORCHA review, and you may have heard of that. So we actually call it the baseline review. And what we've done is we've taken all of those regulations and worked out, well, what is consistent across all of them on a global level. And we built that into the ORCHA baseline review. And it's around about 350 point assessment covering data, security, clinical and user experience. And it's a desktop analysis that we take a product through independently. And this is really trying to work out, well, we'll go through the bulk of the questions and the assessment once. Once you've gone through that bulk of the assessment, actually then you've achieved your foundation level. What you then can go on to is there's a new standard that's coming into effect at European level called the ISO 82304-2. They always have snappy names, don't they? But the ISO, we've been working with the Commission and the fantastic group who've been pulling that standard together. And what they've done is they've looked at the ORCHA foundation layer or baseline review. OBR stands for ORCHA baseline review. And they've taken that as their foundation layer, and then they've added some additional questions on top, particularly around ethics and data security. And the idea is that obviously if you go through the ORCHA foundation review and you pass that, then you can then move on to the ISO standard, and it's meant to be a journey that means that you can start to grow and gather badges of accreditation. And the EU ISO will be adopted at European level, so that everybody can have this foundation layer of trust that people now know if a product's gone through that process, then they can trust it. And that just means that everybody can leverage the benefit. Now, we're using that work not just in Europe, but also internationally, which I'll share with you in a moment. Now, on top of the EU ISO standard, you then have enhanced review components. So I'm going to talk you through what I mean by this in a second, but enhanced review components would be a more detailed analysis on top of that EU ISO, and it's using this enhanced review, which is where you start to see the accreditation regimes like the NHS DTAC. So the accreditation regime is if you pass through the ORCHA baseline review, the EU ISO, and then you have additional questions which are very, very specific to the NHS, then you can get that badge of accreditation. And that's the same in other countries as well. So it's using this layered approach, which means that once you've done the baseline compliance assessment, you then only have to add additional few questions for the ISO, the enhanced assessments, and then you can get your accreditation. And obviously what it means is that everybody can leverage the benefit from the work that you've already gone through, because there's a lot of work that goes into going through a process of accreditation, and this idea of duplication just isn't going to stick. You know, what we don't want is this regulation versus innovation. We need to bring the two things together. So this is the approach that we're trying to support accreditation regimes with. So just to give you this is another picture really, which just depicts that pyramid. So you have the ORCHA baseline review, and then you have the EU ISO. We also work in America, so there are some specific elements like the HIPAA standards, and then you have the enhanced review components that sit on top. So by way of example, the NHSX DTAC assessment criteria picks up around about 80% of the ORCHA baseline review, around about 70% of the EU ISO, and then it has a couple of enhanced review components. Now what it means is that if you've already gone through a process for the EU ISO or the ORCHA baseline review, then you can leverage the information that's stored within our database. When we review products, what we do is we put the information from that review into a database, so it's not kept on paper. The other thing that's really important here is the ORCHA baseline review is continuously re-reviewed. So every time you update your product, that re-review happens automatically. And the reason that's important to us, I'll come on to in a little while, but that's really about us distributing. So just to give you another idea, we're working across the Nordics, so the Nordic Interoperability Programme. The name will indicate a huge focus on interoperability, but what they do is they're going to leverage all the work that we've done from the ORCHA baseline review. They're going to use the EU ISO, and then they're going to have an enhanced review component, which will be an additional couple of questions around interoperability, which is specific to the Nordics. And that criteria will then, once it's been checked, assessed and approved, they will then receive a Nordic-wide badge of accreditation, which is basically a badge of trust, so that people across the Nordics, healthcare systems and healthcare professionals know which products have achieved that level of accreditation. Again, this is the Netherlands. They use, again, the ORCHA baseline review, so they're able to leverage all the work that's already been established. They're going to use most of the EU ISO standard. It may change, so they may incorporate the whole of that ISO standard. That's just in discussion at the moment, but at the moment it doesn't. And then they have a specific enhanced review component around user design, which is very much around cultural fit for people in the Netherlands. And there's a very, very clear couple of questions, which means then that if you want to go and work in the Netherlands, you want to get the Netherlands badge, then we can tell you what those questions are. Just to note that at the moment, this work is predominantly focused on mental health. So in the Netherlands, they're predominantly interested in products to support mental health, but again, it's looking likely that that will expand. In Germany, so Germany is really quite exciting, so they have the DIGA process, and you can download that. It's DIGA, and they've created an assessment framework which basically covers the ORCHA baseline review and the EU ISO. Now what's exciting with that piece of work is once you achieve a pass on the DIGA, you can then be prescribed, and there's a payment mechanism. So they've passed a law that says if a healthcare professional prescribes you your product to a patient, the health insurer will pay for that product. At the moment, only 2 products have gone through that process. It's quite a lengthy process. Just watch this space. It will improve, and processes will progress very, very shortly. We're also working in America with the American Telemedicine Association. We're just building their accreditation regime at the moment, but it's looking highly likely that it will include the ORCHA baseline review, the EU ISO, USA-specific HIPAA requirements, and then an enhanced evidence requirement. So it's looking likely that that will then achieve a badge for the ATA, who are the trusted the trusted organisation for export into America. This is Israel. So we've been working with Israel for maybe about 12 months now, working to build their accreditation system. And again, you can see that they've chosen a data security enhanced review component. So what I'm trying to really show you here is that you only have to go through the bulk of the questions once, and then we can help you to then export into different countries. We've got other countries just coming on board, so New Zealand and Canada, etc. But the idea is that you only need to go through the bulk of these questions once, and then we can leverage the work that's already been done. Now, why is this important to us? I said at the beginning that although we review and we've become a real expert in reviewing and processing digital health assessments, actually our mission isn't to review, our mission is to distribute. And so what we do with our database of information is we then put that information into digital health libraries or app libraries. And these can either be at national, regional, local or organisational level. And these digital health libraries are then filled with the high quality products that have met the requirements for that environment. And this is really important, because if you go through an assessment or an accreditation process, which is hard work, actually what you need to know is that your product will then get distributed to the people you need them to get distributed to. So we create these digital health libraries which are promoted to healthcare professionals who use those digital health libraries to prescribe from. So if I'm a doctor, I can go into one of these libraries. I now don't use it as a library, I use it as a formulary to recommend products to my patients via text message. And this is really important for that particularly those pieces around raising awareness, access and governance. So healthcare professionals use this system to recommend products to their patients. We've seen a growth of 6,500% in the number of recommendations since the start of COVID. And the reason, one of the big reasons why, is because we're continuously re-reviewing products to continuously assure that the product has maintained its quality. And that's really important if you're a prescriber, because if I'm going to prescribe you a product, I need to know that it's good today and tomorrow and in the future. And our system can continuously maintain that. Within this system as well, just as an aside, we also provide education and training to the healthcare professionals so that they can learn a little bit more about the world of digital health and learn more about the digital health products that have gone through the review process. And it's all CPD accredited, so that healthcare professionals can really start to learn a little bit more, because as a prescribing healthcare professional, you're not going to prescribe something unless you feel comfortable with it. And that comfort comes from education training. Now, the other thing that we do is we're also supporting the ongoing economic sustainability. So we built this is in the NHS, so this isn't international just yet, but within the NHS we've built a dynamic procurement system with it's actually London procurement partners. It's not just specific for London, it's a national procurement framework. And what we're seeing is that healthcare systems who have digital health libraries, who have healthcare professionals prescribing these solutions, also now want to pay for these solutions on behalf of their patients or populations. We've seen it actually at a national level as well as a regional and local level. So what the commissioners or the payers can do is go to this procurement framework, know that these products have gone through an assurance process. They can pick the product and then pay for that product at point of prescription. So it's an easier process because my background is the NHS. it's a real challenge to get through procurement rules and regulations. So that's why we put that into play, because the other thing is as many of you will know, it's really, really hard to get that payment mechanism in place. It takes a long time. So again, we wanted to break down the biggest barrier, which was trust, and also then make sure that products have met procurement regulations, so that as a commissioner of products, I can now feel comfortable and go through a quick process. So again, we've seen a lot of growth through that process. And just really also wanted to share with you some of the increases of digital health apps since COVID. So as I've said a number of times, we know that this is a really challenging environment for innovators, but what we're also seeing is a significant increase in use, recommendation and downloads of digital health apps. So we are starting to see a marked change. Healthcare systems globally are really waking up to the fact that digital health can truly support, particularly during the pandemic. So that was all I wanted